Today, I'm going to walk you through something that may completely shift how you see high blood pressure. Not a trick, not a miracle cure, not a headline designed to shock you, but a perspective that explains why so many intelligent, disciplined people do everything they're told and still feel like they're losing the battle. What if the key to reversing arterial plaque isn't another pill, but a precisely designed meal? I'm Dr. Natalie Brooke, and after years of working with cardiovascular patients, I've seen firsthand what plaque really does inside the arteries. Today, I'm going to show you how specific foods can activate the biological pathways that support nitric oxide production, cholesterol removal, and arterial repair. I'm Dr. Megan Foster. For more than 2 decades, I've sat across from patients who were frustrated, confused, and scared. They cut back on salt, they lost weight, they exercised, they took their medications exactly as prescribed, and yet their numbers either refused to cooperate or they technically improved, while the person sitting in front of me felt worse than ever. That disconnect is what we need to talk about. Because blood pressure is not just a number you see on a screen. It's not a grade. It's not a verdict. And it's not a simple problem with a simple switch. It's a reflection of how your entire cardiovascular system is functioning in real time. And the reason so many people struggle is because we've reduced something dynamic and complex into a single static measurement. Let's start with the biggest misconception. Blood pressure is not fixed. It is constantly changing. It rises when you climb stairs. It drops when you relax. It shifts when you eat. It responds to stress, temperature, hydration, sleep, and even your thoughts. Your body is designed to regulate pressure moment by moment. The real question is not, what is your number right now? The real question is, how well does your system regulate pressure over time? Because healthy regulation means smooth adjustments. Unhealthy regulation means exaggerated spikes, poor nighttime recovery, and a system that stays activated longer than it should. Think of it this way. 2 people can both have a reading of 140/85 in a doctor's office. One person has flexible, responsive arteries, and that number drops quickly once they relax. The other has stiff vessels, poor sleep, chronic stress, and their pressure stays elevated most of the day and night. Same number. Completely different physiology. That's why chasing a number without understanding the system often leads to frustration. So what actually drives this regulation? One of the most important factors is arterial flexibility. Your arteries are not rigid pipes. They are living tissue made of smooth muscle and lined with delicate endothelial cells. When your heart pumps blood, those vessels should expand slightly, absorbing the pressure wave. Then they gently recoil. That cushioning effect protects your organs and keeps pressure stable. But over time, arteries can lose elasticity. Chronic inflammation, oxidative stress, high blood sugar, inactivity, smoking, and long-term stress all contribute to stiffening. When vessels stiffen, the same heartbeat creates higher pressure. Nothing changed about your heart. Nothing changed about your blood volume. The vessels simply stopped responding efficiently. And here's the hopeful part. Flexibility can improve. Moderate, consistent aerobic movement is one of the most powerful ways to restore vascular responsiveness. Not extreme workouts, not punishing routines. Simple, regular activity. When you walk briskly, cycle gently, or swim at a moderate pace, your body increases nitric oxide production. Nitric oxide is a signaling molecule that tells blood vessels to relax. Over time, that repeated signal remodels the vessel wall in a healthier direction. I've seen patients drop double digits in systolic pressure simply by committing to short daily walks. No dramatic diet overhaul, no new medication, just consistent movement. And timing matters. Walking for 10 to 15 minutes after meals helps your muscles absorb glucose. That reduces insulin spikes. And insulin, when elevated, signals your kidneys to retain sodium. More sodium retention means more fluid in the bloodstream. More fluid means higher pressure. So a short walk after dinner is not just exercise, it's metabolic regulation. Another overlooked factor is potassium. Most conversations focus only on sodium, but sodium and potassium work together. Potassium helps relax vascular smooth muscle and supports sodium excretion through the kidneys. The problem is not that most people salt their vegetables. The problem is that most people eat packaged foods that are high in sodium and low in potassium. Leafy greens, beans, potatoes, squash, fruit, and fish provide meaningful potassium. When intake improves, vascular tone improves. It's not about eliminating salt entirely. It's about restoring balance. Now let's talk about something that quietly keeps blood pressure elevated even when diet looks perfect: the nervous system. If your body spends most of its time in a stress response, your vessels stay slightly constricted. Your heart rate runs higher. Your body prepares for threat. Chronic sympathetic activation is like driving with one foot slightly pressing the gas pedal all day long. Deep, slow breathing can activate the parasympathetic nervous system. Just 5 to 10 minutes a day of paced breathing can measurably reduce blood pressure over weeks. Sleep is equally powerful. At night, your blood pressure should dip. If it doesn't, your cardiovascular system doesn't recover. Poor sleep, late meals, alcohol, and late-night screen exposure all interfere with that dip. Finishing dinner earlier, reducing alcohol, turning off screens before bed. These small changes support circadian rhythm and improve nighttime regulation. And then there's alcohol. Even moderate intake can elevate nighttime blood pressure and fragment sleep. Many people see measurable improvements within days of reducing or eliminating alcohol. None of this is about perfection. It's about patterns. Now let's talk about medications, because this is important. Medication is not failure. For many people, it's protective and life-saving. But dosing must be individualized. Too low can be as problematic as too high, especially in older adults. Dizziness, falls, cognitive fog, kidney strain, these are real risks of overtreatment. If you feel consistently lightheaded or exhausted, that's a conversation worth having with your doctor. The goal is not the lowest possible number. The goal is safe, stable regulation that protects your organs while preserving quality of life. So what does all of this mean for you? It means high blood pressure is not just about restriction, it's about support. Support vascular flexibility through consistent movement. Support mineral balance through whole foods rich in potassium. Support nervous system regulation through sleep and breathing. Support metabolic health through meal timing and post-meal movement. Support recovery by limiting alcohol and reducing late-night stimulation. Pick one change, just one. A short evening walk, an earlier dinner, a week without alcohol, 10 minutes of breathing before bed. Consistency beats intensity. Track trends, not single readings. Watch patterns over weeks, not hours. And most importantly, remember this: your body is trying to regulate. It is not your enemy. Blood pressure is a signal. When you understand the system behind the signal, fear decreases. Clarity increases. Action becomes purposeful instead of panicked. You are not broken. You are not failing. You are navigating a complex system that responds to small, sustained changes. And those changes add up. Before we move forward, I want you to take a breath with me, because what we're about to talk about might be the missing layer most people never hear about. We've discussed movement. We've talked about minerals. We've looked at sleep and stress. But there's another piece that quietly influences blood pressure in ways that are subtle, yet powerful. And that piece is inflammation. Not the kind you feel when you twist your ankle, the kind that simmers quietly inside the body. Low-grade chronic inflammation changes how blood vessels behave. It alters the lining of your arteries. It interferes with nitric oxide production. It increases stiffness, and over time, it shifts your baseline pressure upward. The challenge is that you don't feel it happening. You don't wake up thinking, "My arteries feel inflamed today." Instead, it builds slowly, often driven by everyday habits. Ultra-processed foods, poor sleep, chronic psychological stress, sedentary behavior. blood sugar spikes, repeated alcohol exposure. None of these individually destroy your health overnight, but together they create a steady internal signal that keeps your system slightly on edge. When inflammation is present, the endothelial lining of your arteries doesn't function optimally. That lining is supposed to release substances that relax vessels when needed. When it's impaired, vessels stay tighter, less responsive, less adaptable. And adaptability is everything. Healthy blood pressure isn't about being low all the time. It's about responding appropriately and then returning to baseline efficiently. Inflammation delays that return. So what lowers inflammation in practical, sustainable ways? First, whole foods. Not extreme dieting, not elimination of entire food groups unless medically necessary, but shifting the balance toward foods that your body recognizes. Colorful vegetables, legumes, nuts, seeds, fatty fish, olive oil, whole grains. These foods provide antioxidants and polyphenols that support endothelial health. They reduce oxidative stress. They enhance nitric oxide availability. When patients gradually replace processed snacks with real food options, we often see measurable improvements within months. Second, blood sugar stability. Even if you are not diabetic, large glucose spikes can temporarily stiffen arteries. Repeated spikes over years create long-term vascular damage. Pair carbohydrates with protein and healthy fat. Avoid drinking calories. Move after meals. Eat fiber-rich foods. It's not about perfection. It's about flattening the peaks. Now let's address body weight, but in a way that's honest and respectful. Excess visceral fat, the fat stored deep around organs, is metabolically active. It releases inflammatory signals. It influences insulin resistance. It affects kidney function. But focusing only on the scale misses the point. Improving metabolic health often matters more than chasing a specific number. Some people lose just 5 to 7% of their body weight and see dramatic changes in blood pressure. Others improve markers significantly without major weight change simply by increasing activity and improving food quality. Your body responds to direction, not punishment. Then there's hydration. Mild dehydration increases vascular resistance. When the body senses low fluid availability, it constricts vessels to maintain pressure. Many people walk around slightly dehydrated every day. Drinking water consistently throughout the day, especially earlier rather than late at night, supports stable regulation. Caffeine is another interesting factor. For some individuals, caffeine causes a temporary rise in blood pressure. For others, the effect is minimal. The key is awareness. Check your pressure before coffee and again 30 to 60 minutes after. If there's a significant rise, consider reducing intake or switching to lower caffeine options. You don't need to eliminate everything you enjoy. You need data and self-awareness. Now let's talk about the kidneys. The kidneys are central to long-term blood pressure regulation. They manage sodium balance and fluid volume. When kidney function declines, even slightly, pressure often rises. That's why routine lab monitoring matters. But kidney health is influenced by blood sugar control, hydration, blood pressure itself, and medication management. Everything connects. And this is where I want to shift your perspective one more time. High blood pressure is rarely caused by a single villain. It's usually the accumulation of small stressors layered over time. Chronic tension, poor recovery, nutrient imbalance, inactivity, inflammation, sleep disruption, layer upon layer. Which means improvement doesn't require a dramatic life overhaul. It requires removing layers gradually. Let me tell you about a patient I saw several years ago. He was in his early 60s, active in his career, not sedentary, but not exercising intentionally either. His blood pressure hovered in the mid-150s despite medication. He felt discouraged. Instead of changing everything at once, we chose 3 actions. 10-minute walk after dinner. No alcohol during the work week. Lights off by 10:30 p.m. That was it. Within 8 weeks, his systolic pressure dropped nearly 15 points. We adjusted his medications slightly downward. He reported better energy, better sleep, clearer thinking, no extreme diet, no boot camp workouts, no supplements costing hundreds of dollars, just layered consistency. This is important because fear often drives people into unsustainable routines, intense diets, overtraining, severe restriction, then burnout, then rebound. Your cardiovascular system responds best to steady signals, regular movement, predictable sleep, balanced meals, managed stress, moderate alcohol or none at all, routine check-ins, and let's talk about home monitoring. White coat hypertension, elevated readings only in clinical settings, is real. So is masked hypertension, where office readings look fine but home values are higher. Using a validated home cuff, sitting quietly for 5 minutes, feet flat on the floor, arms supported at heart level. This gives you meaningful data. Take readings at different times of day. Track weekly averages. Look for trends. Numbers tell a story over time, but they are not a moral judgment. If you see a higher reading, ask what influenced it. Poor sleep, stressful meeting, salty restaurant meal, missed medication. Curiosity replaces shame. And that mindset shift matters more than you realize. Because chronic anxiety about blood pressure itself can elevate blood pressure. The more you catastrophize each reading, the more your nervous system activates. Instead, think in patterns. Is the overall trajectory improving? Are nighttime values dipping? Are you feeling steady, clear, energetic? Health is multidimensional. Now I want to address something many people are hesitant to discuss: aging. Blood vessels naturally stiffen with age. That's biology. But the rate of stiffening varies dramatically between individuals. Some 70-year-olds have vascular health similar to people decades younger. Others show accelerated aging due to cumulative lifestyle factors. The encouraging truth is that even later in life, improvements are possible. Exercise increases arterial compliance at any age. Dietary shifts improve endothelial function within weeks. Stress reduction lowers sympathetic tone regardless of age. It's never pointless to start. And finally, I want you to remember this. Blood pressure management is not about achieving a perfect number for a day. It's about protecting your brain, heart, kidneys, and blood vessels over years. It's about reducing stroke risk, lowering heart attack risk, preserving cognitive function, maintaining independence. Those outcomes are shaped by daily decisions, not dramatic declarations. So if you're feeling overwhelmed, simplify. Choose one habit this week, commit fully, then add another next month. Layer stability, layer resilience, layer recovery. Your body is not static, it is adaptive. When you consistently send signals of safety, nourishment, and movement, it responds. Maybe not overnight, but steadily. And steady change is the kind that lasts. You are not chasing perfection. You are building regulation. And regulation is strength. That is how you shift from reacting to numbers to understanding your system. And once you understand your system, you stop feeling powerless. You start feeling capable. Because the goal isn't control. The goal is balance. And balance is built, one decision at a time. If this perspective helped you see blood pressure differently, stay curious, keep learning, keep observing your patterns. And remember, small, consistent shifts today protect your future self in ways you may not see immediately, but you will feel for years to come. Stay with me, because understanding the mechanism changes everything. Your arteries are living tissue. They respond to signals every single day. If you consistently support the right pathways, your body can begin to repair from within. That's the power of informed action. I'm Dr. Natalie Brooke. If you found this helpful, subscribe, share it with someone who needs it, and I'll see you in the next video.